In my final semester of my MPH, I took a class on comparative effectiveness and outcomes research, which I thought was a really fascinating culmination of methods for thinking about how we can trade off difficult decisions that we're making in healthcare. So I thought it would be really cool if I could get a job that was in this area so that I could learn these methods a little bit more. And I ended up getting a job as a research associate at Georgetown University. And there I got to work with a whole group of modelers and health economists and cost effectiveness researchers and clinicians who are using these computational models to evaluate cancer prevention and control policies and tobacco control policies, and conducting really high impact research informing guidelines for the United States Preventive Services Task Force and other national bodies. And that was really my foray into research. And I thought, oh, this is really cool, the space that I want to be in. When researchers and policymakers and even clinicians are thinking about how they're valuing healthcare, we traditionally think of it in terms of cost. So how much a treatment might cost, what are the downstream costs of future medical care that a patient might need, as well as their impact on health. So it might impact the length of somebody's life or the quality of somebody's life. And we generally seek to balance these two metrics. So we're getting as much health outcome as we can for the amount of money that we're spending. But this kind of leaves out a whole other chunk of things that we often really care about. We know from a lot of research that people really value promoting equality and equity in our healthcare system. And people really value things like treating people with more severe health conditions or making sure that we have treatments for really rare conditions. What I'm trying to do are identify some key areas that fall outside of this balance of cost and health outcomes and figure out a couple of areas that people really value and then try to quantify the extent to which people value that by asking people in a couple of surveys to make trade-offs between improving, say, the health of someone with a really rare disease and someone with the health of someone without a rare disease. And by doing these kinds of trade-offs in a survey, we can kind of quantify the extent to which people are willing to value the health for, say, a rare disease or a more severe disease. And then we can kind of incorporate that into our larger modeling efforts to value healthcare in terms of both cost, health outcome, and these other equity considerations. So I think the PhRMA Foundation support's going to have a huge impact both on my research at this stage and my career down the line. So for today, for right now, it means that I can spend a lot more time focusing on my own work. As doctoral students, we're often pulled in a whole lot of different directions. And one way of making sure that we can stay focused on one specific thing is by getting funding to support us to do this one thing. As for my career, that's where I think it's going to have the really big impact. Academic candidates are highly valued if they have a track record of securing funding. An academic job, finding and keeping funding throughout your career is really important. So being able to show from the get-go that in your doctoral work, you were able to secure competitive funding, I think is really valuable there. As for a job in industry where you don't necessarily need to worry about tracking down grant funding, it's the brand of the PhRMA Foundation and the opportunity to network with so many people who are doing this work across industry, academia, consulting, government. I think just tapping into that network and having that PhRMA Foundation name associated with mine is going to be really valuable. As junior researchers, we can often count ourselves out for things, thinking we don't have enough experience. There are going to be so many better people. Just look around my department. I'm surrounded by all these other really smart, really excellent PhD students. They should all be getting these awards. I don't know why somebody would pick me, but you don't know unless you apply. And even if you apply and don't get something, reapply, reapply, and reapply. Uh, so don't take yourself out of the running.